everyone, welcome back to Injecting Knowledge. I'm Nurse Kaylee, and today we're going to be breaking down Disseminated Intravascular Coagulation, or DIC, a serious condition that you will need to know for your nursing exams and nursing practice. Grab your notes and let's get into it. DIC is a life-threatening condition where the body goes haywire trying to clot and bleed at the same time. It's a secondary condition, meaning it happens because of something else, like sepsis, trauma, obstetric emergencies, or cancer. Basically, the body starts making a bunch of tiny clots everywhere, which uses up all the clotting factors and platelets. Then, when the body actually needs to clot, it can't. So now the patient is bleeding out. It's a double whammy. The biggest cause of DIC is sepsis. Severe infections can trigger this condition, but it can also happen with trauma like burns or crush injuries, obstetric complications like placental abruption or amniotic fluid embolism, cancer, especially leukemia, and shock or severe transfusion reactions. Now let's talk about what you'll see in a patient with DIC. At first, you might notice signs of clotting, cyanosis or ischemia in fingers and toes because clots block blood flow. Organ dysfunction like kidney failure or confusion because our kidneys are the first one to give up. Then, as clotting factors run out, the patient starts bleeding everywhere. Then you will see petechiae, oozing from IV sites, surgical wounds, or gums. Internal bleeding, watch out for hypotension and hematuria in GI bleeds. If you suspect DIC, you'll check coagulation labs. Here's what you'll see. Platelets will be decreased, fibrinogen will be decreased, PT and APTT will be increased, and D-dimer will be super high because clots are breaking down. A high D-dimer is a major red flag, but in DIC, you'll see everything abnormal. Here's the deal. DIC isn't the disease. It's the symptom of something bigger. So the first step, fix the underlying cause. If it's sepsis, give antibiotics and fluids. If it's OB related, treat the obstetric emergency. If it's cancer, manage the malignancy. Meanwhile, we support the patient with blood products, heparin, only in chronic cases to stop clot formation, and oxygen and fluids to maintain perfusion. As nurses, we have to monitor closely for bleeding, prevent injury, and educate the family about how serious this condition is. Alright, let's do a quick review to help this stick. DIC equals clotting and bleeding at the same time. The most common cause is sepsis. Lab values will be decreased platelets and fibrinogen, and increased PT and APTT, and D-dimer. The treatment for this is to fix the underlying cause and support with blood products. If you see a patient oozing from IV sites and their D-dimer is through the roof, think DIC. I hope this breakdown helped you understand DIC. If you like this video, don't forget to like, subscribe, and hit that notification bell so you don't miss any future videos. Until next time, thanks for watching, and I'll see you in the next video.